Welcome to Weekend Night Live, hosted by Samuel Jacobs Abbey, where we play music, talk shows, and interviews on Be Inspired Podcast Network. Stay tuned and keep your dial on www.beinspiredpodcast.com. Don't forget to stay connected, be inspired, be unique, and be different.
Hello, my name is Quan Green, and I would love to share some products that I found that are very beneficial to not only my body, but I'm sure that they would really help your body. I found out that a lot of us are impacted and we need to be detoxed, and I found some wonderful products that will safely detox you and help you to eliminate the waste and feel good about yourself. We also have products that will help grow your hair and give your skin more vibrant radiance and suppleness and help with wrinkles. I also have products that will help with joint pain as well as help you to lose weight. These products are all natural, therefore you don't have to worry about putting something in your body that's going to add problems to the problems that you may already be facing. So if you're interested, please give me a call at 706-426-1471, or you can email me at preciousjewel492@gmail.com. Thank you and have a blessed day.
Wamaya, Wamaya, don't you? 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 Wamaya, Wamaya, don't you?
Okay. Hi, my name is Samuel Jacob Sabi, and I'm the host of Be Inspired with the Weekend Night Live with Samuel Jacob Sabi on Be Inspired Podcast Network. I just want to invite you and your family to tune in every Saturday at 3:30 p.m. Eastern Time and also at 7 p.m. GMT for those across the Atlantic Ocean to tune in to listen to inspiring voices, to listen to our interviews, individuals who have excelled in different forms of life. We bring them so they will be able to share their stories, and we know that their stories will have an effect on you. On Being Inspired Podcast Network, our mission and our goal is to empower people from around the world who have attained a certain height and sharing their stories to make a social change implication. Social change is very important, and it is important that individuals, families, society, and leadership spend time to acquire knowledge and skills to help formulate policies and ideas to help shape their communities. That is the more reason why I want to invite you again to tune in every Saturday at 3:30 p.m. Eastern Time and also at 7:30 GMT on Be Inspired Podcast Network. You can catch us up on www.beinspiredpodcast.network, or you can also join us on our Facebook at Be Inspired Podcast Network, and we can have fun. Once again, tune in and have fun. God bless you.
All right, friends and families, ladies and gentlemen, I want to take this opportunity to welcome all of you to Be Inspired Radio. We are always excited to talk about social change implications. And today is one of the days that we want to talk about a very important program, that cervical cancer. Cervical cancer has been a major public health issue that a lot of people are not even privy to what it is and then how we got into this place in the first place. So today we want to spend some time to discuss that. To do that, we are very privileged to have Gloria Youngson, who has been a great supporter of this program. We are so privileged that we are going to interview the CEO of Cancer Connect Ghana in the person of Gloria Youngson. Very experienced. He has dealt with cancer issues from different perspectives. And then also, she is an oncology nurse who studied both in Ghana and the UK. So let's welcome to the studios of Be Inspired Radio, Gloria Youngson. Gloria, welcome to Be Inspired.
Thank you very much for the opportunity, and hello to the listeners.
Oh, great. We are very grateful that you find some time. I know last week we were trying to get you on board, but unfortunately we had some technical issues and we couldn't get you to talk to our listeners. I recall we had over 22,000 people who were patiently waiting to hear from you, but sometimes technology has its own way of getting our way. But we thank God that today we have the opportunity to discuss it. So let's go quickly into our conversation. Cervical cancer. You know, we've heard all kinds of cancers, but a handful of people are cervical cancer. So can you take a moment, just a brief about cervical cancer and why should we even care about it?
Yes, thank you very much. So, as we may know, cancer is basically a disease of abnormal cells, and these cancers can happen anywhere in the body. But particularly to cervical cancer, this is cancer that happens in the cells of the cervix. And you would ask where the cervix is. And most women, I believe, would know, but sometimes the men may not know. So basically, the cervix is the opening to the womb. That's a simple way of knowing it. And for women, it's very important to us because it's on a monthly basis, when we have our menstrual cycle, that is where the blood will flow through. And then when you're privileged enough to get pregnant, the cervix is very important because it needs to be closed to keep the baby in the womb till such time when the baby has to come out. And then again, when it's time for the baby to come out, the cervix is also very important because it dilates or opens up to a certain degree for the baby to be able to come up. So for women and for our reproduction, the cervix is very important. Most times we don't place much emphasis on the cervix, I would say, compared to the breast. Because of where it is, it's basically not on the outward and female, it's inside. So sometimes we do forget about the cervix, but it's a very, very important organ that God has given us.
Wow, great. So now, what one may ask, what actually causes the cervix to develop a cancerous disease? I mean, of all places, why cervical cancer?
One of the things that I always ask, especially when I started oncology, is what at all is this abnormal cell? And sometimes it's in the most inconspicuous of places that you actually find that there is a cancer. So you have cells in any part of the body, let me put it that way. And therefore, anywhere on the body, inside or outside, that has cells, has the ability to have cells that will become abnormal. And these abnormal cells is what develops into a cancer. Some of them will develop into a cancer, some of them will be benign. So what causes cervical cancer, unlike the other cancers, is very well known now. And it's actually the most preventable form of cancer you can find. Cervical cancer is caused by what we call the human papilloma virus. So it's basically a virus that causes this cancer. There are other risk factors as well that add on to it. But we know that about 90% of all cervical cancers are caused by this virus called the human papilloma virus. Now, this human papilloma virus is something that is you can find in most women when they become sexually active. So most women will have the human papillomavirus in and around the cervix, the vagina, basically from the vagina all the way up to the cervix. The body's immune system is supposed to clear it off, but there are some times that it's not able to. And there are some sorts of types of these viruses. The most notorious ones are called the HPV-16 and that of the 18. These two ones are the ones that causes cancer. And when you actually have this and the body immune system is not able to clear it and it stays in there for a longer time, then it starts changing the cells in the cervix. Then it becomes abnormal, and then gradually it turns into a cancer. So for cervical cancer, we know that the HPV would cause what we call precancerous cells. It doesn't mean that you have cancer, but I mean that you may be able to get cancer if nothing is done about it. And these precancerous cells mostly are found during screening, and it can actually be treated, and then you're fine. You're rid of those precancerous cells. But then again, the HPV the infection can reoccur. And if the body doesn't clear it away, then you need to have continuous screening. So we normally advocate that women from the age of 21 years should start screening. You would ask, why 21? We know that most women start becoming sexually active now, not just in Africa, but worldwide, from the age of 11, 12 years or so. And therefore, at the age of 21, that's almost 10 years or more, we know that those viruses would take that long to develop into a precancerous cell, and maybe another 5 to 10 years to develop into a cancer. So it is very slow growing. But then again, it starts at an early age. So if this is not picked up, when the woman gets into her 30s, 35, that is when these cancers are detected. And it's very devastating. And when you get this, because of where the cervix is, it's hidden. And therefore, before you can get any signs or symptoms, then it is far gone. And most women come in, and unfortunately, there isn't much we can do for them, and we lose them.
Wow, wow. Now, the way you described and talked about it, I recall when we once hosted you on our show, and we talked about breast cancer during the Cancer Awareness Month of October last year. I mean, you were, you sound very alarming, but it looks like you don't seem too alarmed when it comes to cervical cancer. Is it because it's more preventable than the rest of the cancers that we are aware of, or what actually? As compared to, of course, every cancer is bad. Nobody wants it, but I can feel from your voice that you sound more hopeful than the last time we had you.
Yes, because cervical cancer is very preventable. And if we're able to vaccinate our girls from the age of 9, and then also start screening in earnest, especially in this part of the world, which is in Ghana where I sit, then we're able to prevent this cancer. At least I would say for cervical cancer, we can prevent it. Australia is one country that is actually getting closer to eradicating cervical cancer completely. And you ask yourself, how do they do it? So they have taken it upon themselves to vaccinate all their girls, and not just girls, boys, because the men or the boys are the carriers of these HPV virus that hand it over to the women. So if they are vaccinated against it, then the likelihood is then they won't pass it on to the women. And then also they screen every woman from the age of 21. So for cervical cancer, there is hope. And then it's also very cheap or less expensive, let me put it this way, if we're able to start from vaccination and screening instead of wait until they get the cancer. So unlike breast cancer, you would only detect it when there is a lump. You cannot actually prevent it in the terms of what I'm talking about, cervical cancer. However, you can reduce your risk drastically not to get breast cancer. But with cervical cancer, you can actually vaccinate against it, like we have done for polio, we have done for hepatitis. You can actually vaccinate against it. And now when you talk about polio in Ghana, it's basically non-existent. So if we're able to vaccinate our girls and our boys, then 20 years down the line, we wouldn't be hearing this, because a girl of 9 years who is vaccinated today, 20 years later is 29 years. The chances are they wouldn't get any precancerous cells, let alone cervical cancer down the line. So it's a systematic approach that we need to take. And if nothing at all, I believe Africa and Ghana is able to win that war against cervical cancer, if not the other cancers. I think we can start it. We can start with cervical cancer, and then see how far we go. Another bit as well is cervical cancer is actually killing more than, out of the world, the cases or those diagnosed in the world, almost 250,000 people diagnosed a year. 87% are actually in Africa.
Wow.
Of those diagnosed, yes. And out of this 87%, more than half will die in Africa.
Wow.
So,
but then the question is that when a disease like cervical cancer is preventable, like we say in the United States, what the hell will we allow that to kill about half of the people who are diagnosed? Now, does that mean that our health system does not really pay attention to what is going on around the world, or is just simply that people do not allow themselves to be checked? Because, of course, just as you cited, Australia almost eradicating cervical cancer, I'm sure they may have put some policies in place, health policies in place that will require or mandatorily require women within the active sexual age to undergo screening. Why can't we incorporate such things in the rest of the world, especially in African countries?
So that is what you mentioned, policies. I think I said that the last time. We lack cancer policies. And that is what we are faced with here in Ghana right now and in many parts of Africa right now. So there are no policies in place to be able to prevent this or have control programs to prevent this. So as we speak right now, it's basically the NGOs and then basically private non-profit organizations actually championing the cause of cervical cancer prevention in Ghana. So we don't have that as a policy in Ghana, and coupled with the fact that we don't have a comprehensive data, so we are not able to tell you, apart from what the WHO would gather, but Ghana would not be able to tell you of a fact the number of people that are diagnosed of the disease and those who die. We don't have the data for cancer here. And then also the lack of information and skills for the human resource. So you may possibly be living somewhere in the north or somewhere in the middle belt, and then you'll be seeing a doctor who you may be possibly having symptoms of cervical cancer, but the doctor is not skilled enough, or the nurse is not skilled enough to be able to tell you, this might be cervical cancer, let's screen you, let's check what it is, and then move from there. So they may be treating you for other things other than what they're supposed to be doing for cervical cancer. As well as the fact that there is the accessibility. It's another thing. So our healthcare system doesn't have all these. And I would say it's not a priority, unfortunately, in Ghana, which it should be, because these are the same people that are going to boost the economy. And when you think about it, a woman of 29, 30, 35-year-old being diagnosed of cervical cancer and the chances are they may not survive it, means that they wouldn't be around to help the economy grow. So these are the things that we're faced with here. And it's one thing that I'm advocating for a change or a shift in our policy when it comes to healthcare. Because this is very, very important. And cancer is gradually increasing as part of the non-communicable diseases. It's actually increasing day in and day out, which there are other unfortunate bits. It's killing most of our people. So in Africa, most people diagnosed with cervical cancer, more than 50% wouldn't make it. Unlike in other parts of the world or in North America, where you are. So we have to have a conscious or intentional way when it comes to cancer of trying to prevent these things and also trying to detect them early. Because in the end, it works out to be cheaper. Even if it's the individual paying, it works out to be cheaper for everybody.
Wow. That's that's very concerning, especially when you talk about access and talk about our healthcare reformation. I think it's about time civil society organizations, partner with the Ministry of Health, particularly in Ghana and the neighboring countries, to come out with specified policy change that will help individuals to have access, because access is all important. You see, when it comes to health access, my doctoral dissertation, I worked on healthcare accessibility and quality of life. So access is very, without access, you are just screwed, because it's not just having healthcare, having quality healthcare, and that means that there's a need for some policy shift. But now let me ask you, so a young woman sexually active between the ages of 21 to about 40 years, now how would that individual, without even going to the hospital to be screened, are there any signs or symptoms that this individual could see to realize that, wait a minute, there's a danger coming, I need to go to the hospital ASAP? Are there symptoms and signs at the early stages of cervical cancer?
So for cervical cancer, another thing that is worrying about it is there are no signs and symptoms for early stage cervical cancer. It's very rare. So again, I said because of where the cervix is, it's not like the breast where you can feel it, and therefore you may be able to feel a change in the breast. So the cervix, you cannot feel it, and it can actually be looked at but not felt by somebody else. So when it comes to early stage, most of the time there isn't anything you would be able to see. Possibly bleeding could be one of the first signs and symptoms, not that early, but and earlier than the other symptoms. But then again, when you're a woman of 21 years old, very active reproductively, you would normally see your period once a month. You would have some women, though, who would have irregular periods. And therefore, sometimes it's difficult to tell if this is my period or this is actually bleeding coming from the cervix abnormally. And also, that is what you would normally see. So most women wouldn't attribute it to a problem, unless it's something that is a continuous issue, then they'll normally go into hospital. But at the early stage, it wouldn't be that continuous bleeding. Another sign would be possibly after sexual intercourse, you would bleed, or if you have to have an examination down below, you may bleed afterwards. Or the women who do put different concoctions of stuff down below, which is called bleaching. Once you have taken it out, you may possibly bleed. But most women will attribute it to the fact that, there was a bit of irritation there when they had to go in, or and when they have sexual intercourse and all that. So it's not something that most women will pay attention to. And it's not something that the bleeding will be continuous. So it'll be basically like on and off until it has actually moved a step or higher. Then there may be a bit more bleeding with other symptoms as pain or foul discharge as well. So unfortunately with cervical cancer, it's not like something you can feel or touch on a daily basis or on a monthly basis. And so most of the time, when there are symptoms, then it's more advanced.
Got you. So last week, there was a question that came through, and the question was, so this lady said, well, whenever I'm having my menstrual period, I have a lot of pains and cramps, and sometimes I have a very bad, a smelly odor from my menstrual period. Now, is that a sign of a cervical cancer? If so, do I need to be checked?
So I don't know if this woman gave her age, but if she is above the age of 21, she should be doing her screening. So screening is basically either a pap smear or now very recently the HPV test, which is more accurate. And in some parts of the world, they would do screening, or what is recommended is screening from the age of 21 with a pap test up until you're 30. And then from the age of up until 29, then from the age of 30, you can either do the HPV test only, because we know it's the HPV that causes cervical cancer, or you can actually do both. So in some parts of North America, they're actually doing what we call the co-testing. So if you have pain with your period, and you definitely know they are your periods and it happens every month, either regular or irregular, but it's either possibly 21 days or 28 days, then that is absolutely, I won't say normal because it might be something else, but that wouldn't be cervical cancer, because most women would have pain with their periods or discomfort with their periods. And you may have that foul smell because when you have blood which has been collected into, I'll say, a pad, and it stays there for more than 2-3 hours in a space where there isn't a lot of air, you would have that foul smell. So it's something that happens to every woman, I would say. And some people try to mask the smell with different perfume-scented pads and all that, but I wouldn't advise that. It's a natural process. All you have to do is be very and clean the area very well, and make sure that you're washing down below twice, at least twice a day when you're having your period. So that, I would say, it's part of having your period as a woman or part of menstruation. But then if you have excessive pain where you're not able to do anything, then you need to see a doctor to be able to investigate a bit further if it's dysmenorrhea, which is happening, and therefore they may be able to help you with that. But I wouldn't say specifically it's a cervical cancer. But I highly advocate that she would do her pap test every 3 years, and then from the age of 30, either the HPV or the co-testing, which is the HPV and the pap test, and that would be every 5 years. So basically that is just something very simple. It takes 15-20 minutes to have it done either at the nurse or the doctor's surgery, and then that's you done for another 3 years or another 5 years.
Got you. So another question also came from the UK, and she said, "Well, I have a weak immune system, and so I usually stay on the Granix or GCSF to boost my immune system. Of course, I'm sexually active, and so because of my immune system, should I be worried? Just a thought."
I would say yes, and not just for you, for everybody. because at least you are aware that you have a low immune system. Most women do, but they don't know about it because it doesn't cause any problems for them until there may be an issue health-wise. So yes, but it has everybody else. So for you, for cervical cancer, you should be doing your screening as recommended every 3 years from the age of 21 with a pap test. And then from the age of 30, if you add the HPV test as well, every 5 years. And then not just for cervical cancer, but for all cancers, so you should be doing your clinical, your self breast exams when it comes to breast cancer. And then just basically know your body, so that if anything abnormal or something happens that you're not too sure of, you can then report it and have yourself checked out. So the immune system plays a major role in trying to prevent or stop these cancers. And that would also mean that we're supposed to be eating very well, that's a healthy diet, because that's able to boost the immune system, and especially our fruits and veg. And out in Europe and America, we call it the 5 a day. That is something that we should all be doing, and even here in Africa. So again, when it comes to diseases, it's all tied in together. So it's basically what you put in your body and what the outcome is, and basically, especially when it comes to non-communicable diseases. So what are you putting in? There's a saying that you are what you eat. So it's what you eat, what you put into the body. The outcome is what you see outside as you grow, as you age.
Thank you. Great. So earlier on, you had also mentioned that one of the causes or factors that one needs to pay attention to cervical cancer is the HPV. Now, does that mean that people with multiple sexual partners should be very, very careful?
Yes.
With the possibility
so that is a very high risk factor. So multiple sexual partners. So you may not just be infected by one partner, but 2, 3, 4 who are carriers of the HPV or the HP virus. So yes, that's very important. Smoking also weakens your immune system. So that is something that should be stopped. Alcohol is the same. So either it's in moderation or you'd have to think about stopping if you want to be healthy. And another thing as well is being sexually active at an early age. You start being exposed to the HPV earlier on in life. And also having multiple births, pregnancies and births. That has also something to do with your immune system, and then also access to the HPV virus in the cervix. So these are all risk factors. And again, your diet, what you eat, what you put into the system, and exercise as well, because we know that being overweight or being obese also has a lot to do with the changes in your cells that makes it become abnormal. So these are, as well as the HP virus, are the risk factors that cannot contribute to you getting cervical cancer.
Got you. So, are there any cultural myths that prevents young women particularly? Because, it baffles my mind that if you are sexually active, then you should also be very careful and know all the things that comes with being sexually active. So I find it very strange that, the 86% of women diagnosed of this disease ends up probably in Africa, ends up dying. So do you consider if there is any cultural myth that is causing these women from going to be screened and tested for cervical cancer?
Yes, but before I move to the cultural myth, so just trying to put things into perspective with regards to why we have more women in Africa or in the developing world and actually being diagnosed more of the disease. So being literate or being educated is one of it. So Most women who are uneducated would not link the fact that they are sexually active or having multiple sexual partners as anything to do with health. They would rather link that to being promiscuous, and then the culture shunning that, but they wouldn't link it to the fact that it's got anything to do with your health negatively. And then we would now come to like the cultural myth. But even that, in this part of the world, we don't have the access to screens. So in North America, in the developed world, in Europe, they have that access. And most countries in Europe and in the America are actually offering primary screening for women, which is a cost that is taken care of in whichever way their health system is. So these things are caught early. And in England, where I used to live, you are actually reminded to do your screening. And they will send you multiple reminders until you go. So it's a big issue out there. I mean, it's so important to them because they know that the ripple effect of actually getting a cancer is really bad on the economy. Apart from the fact that the health system is going to spend a lot more money to treat you, you're actually going to lose on what you would have actually given in terms of taxes to boost the economy, you see. But here in Africa, and especially in Ghana, that thinking isn't there. It might be there, but we're not doing anything about it. Then you bring the cultural aspects as well. So again, when it comes to women and their sexuality, it's most often the men, especially in areas where they are uneducated, that would make decisions about what the women should do and not do. So you would have a woman who possibly meets a pap smear, either it's via religion or the tradition. There are some religions that wouldn't allow a woman to go out to have her cervix looked at, especially by a male healthcare professional, and most likely a doctor. So that is something that unfortunately our women in this part of the world are suffering from. So again, I was at the family planning unit here in one of the hospitals, the big teaching hospitals, and there was a woman who wanted family planning because she was having children like within a short time of the other, and she was concerned about it. And she came in and then she told us what it was, gave us a bit of history, and then we advised her. She said to me, I have to go back and get permission from my husband. The following day, the husband came with her. She had actually been beaten at home. She came back with the husband, bruises all over. The husband warned us against doing anything to prevent her from having children. And that was his choice and decision to make, not her. Sometimes women are seen as sexual images, not even human beings, in some parts of Africa. So that could also be one of the cultural or myths and misconceptions and practices that happens here. And especially in some religions, most women cannot be touched by a male person other than their husband. So these are some of the things that we're faced with here as well. But we believe that with education and awareness creation and continuous education and awareness, there will be a shift. And because eventually these women become empowered themselves, and then they would stand up for themselves and make that decision. But without being educated or without the awareness, they don't have any knowledge to be empowered on to make these decisions for themselves. And that is one thing that is lacking. I mean, you have organizations doing bits and pieces with education and awareness, but they are all really, really sparse. We don't have a lot of that. And most times we need a concerted effort. We need a everybody coming together to do this. But you'd have somewhere in the north, me in Accra, doing my bit, trying to move to the other regions, which sometimes is a little bit difficult because of funding and logistics and all that. So you may be able to get a particular community to educate them and empower them. But as a whole in Accra or even Ghana, we're not able to do that. So that's one of the things that we need to do. And I would say if the government is not ready yet, we as a people need to hold our lives in our own hands and be ready. So I'm advocating for individuals, and that's what I do when each time we go out and do our outreaches and awareness and education is your health is in your own hands. You can't start tomorrow. It has to be today because tomorrow might be too late and something has to be done about it today. And I always say to them, I mean, we have a whole lot of, a long list of priorities of things that we should do. But our health should come on top. But if we're not healthy, we're not able to achieve the other things that we want to achieve. And you may think it's costly, but even if you're saving for a cervical cancer screening test, you can actually take a whole year. I say, just give yourself a birthday present and save towards that. And the screening will possibly cost, for some women, it would cost less than maybe saving for a shoe or two. So it's something that you should do for yourself, nobody else. And that is what I encourage the women to do. Hopefully until we can get the government to hopefully change and then prioritize cancer care and prevention.
Wow, I mean, you said it all, and and I totally agree with you that if it will cost you, it doesn't even matter how much it's going to cost you to get screened, because when you are diagnosed, it will even cost you more. So
possibly 20, 30 times more than what you would have paid every 3 years or every 5 years. Yes,
exactly.
Definitely.
Exactly. I think it's all about attitude and behavior and change. So social change is very important, and I like the fact that you always insist and let women, especially, come to their realization that they have absolute control of their body and they need to take care of their bodies, because if they don't, unfortunately, they will have to pay the consequences that comes with it. Gloria, thank you so much.
And you know, for women, it's not just us; it's the children as well, and it ends up being the husbands as well. So we cannot just think about ourselves. So us first, but there are other very important people as well that we need to think about. So we don't have to be selfish and not look after ourselves. It's very important that we look after ourselves. Because when we're strong,
totally agree.
Everybody else is strong.
That's right. Great. Thank you so much for sharing this powerful moment with us and our listeners from around the world. As usual, Gloria always delivers, and I'm sure all of you will take one or two from this powerful presentation. And like you rightly said, cervical cancer is one of the most preventable cancers in the world. And so the choice is yours. You've heard the message. Ours is to inform and to impart you with knowledge. It is your responsibility to take their knowledge and make good use of it. Once again, on behalf of the staff and management of Being Inspired Radio, I want to extend my heartfelt greetings and gratitude to Gloria Youngson for spending the evening with us at Being Inspired. Gloria, once again, God bless you and enjoy the rest of your evening.
Thank you. God bless you too. Thank you very much.